Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, a licensed midwife and one of the MCs here at Gold. And here at Gold, we're very busy getting together here with our speakers for our upcoming Gold Summer Learning Day. And here we are with Dr. Carmela Kika Baeza. Welcome, Carmela. It's wonderful to have you here today with me.
Hello, thank you. It's great to be here.
It's wonderful that you're going to be part of this Gold Learning Day. The theme of the day, or the topic, the overreaching topic, is breast-related pathologies and clinical management during lactation. That's such a great topic, I feel. And your presentation is titled "The Art and Science: A Critical Look at the Physiology and Management of Mastitis." And people who know you have seen you in action here at Gold presenting. They know they're in for a treat. Your presentation is always lovely. Your slides are always engaging, and you make it super interactive. I want to talk about that the presentation in just a moment. First, I want to talk about you and your background. First of all, where in the world are you?
Thank you. Well, I'm in very, very sunny Madrid in Spain.
Beautiful. Sounds good. And I assume it's already gotten quite warm in Madrid as well, right? Yeah.
Yes, it's very warm here. But it's lovely actually. We had a very rainy spring, which is not the
Uh-huh.
usual. And so now we're having a very green beginning of the summer. That's great.
Green summer. Beautiful, beautiful. And Camila, you are a medical doctor and a family physician, right? But you're also an IBCLC. So tell us a little bit about your background and how it all fit together and how it all came about.
Yes, actually, I think it's a story that many, many of us have. Is I had a very big difficulty with our first child who had a very important heart problem, and I was not able to breastfeed him. And that got me thinking, how can I be a medical doctor, a family physician, and not know anything about breastfeeding?
Hmm.
And that was going to be about 24 years ago now. So they got me just rolling into this world, and I'm just very, very glad to be here.
And never look back, right?
Never look back.
Never look back. Absolutely. And I think it's lovely how you, put these two disciplines together because you're right. How can you be a physician not knowing anything about lactation? I wish all our physicians out there, pediatricians, would really take this to heart. It should be taught in medical school more. I know it's gotten better. There is a better curriculums out there now, but still, we need more knowledge and knowledge translation too. Uh, Let's talk about the topic
Absolutely.
here. I'm sorry,
Mhm.
go ahead.
No, I was going to say that for me, something that I loved about breastfeeding medicine was all
Mhm.
the emotional and mental health aspect of the support
Yes.
for our clients, because as a medical doctor you were focused on on the symptom and the treatment and the antibiotic, and
Mhm.
so it kind of breastfeeding medicine opens a whole world also to us physicians who are very focused on the little details, maybe sometimes too much.
But it's good, as you mentioned, it's, we're not just a body, we are, mental health is so important. We have to look at all these aspects there as well. So it's wonderful to see that, these two areas are coming together and it's a holistic view, not just, looking at one aspect or one physical aspect at a time, which I think it's very much appreciated. And I feel it's wonderful to see that, it's moving into that direction more and more as well.
Mhm.
Your topic, the art and science, a critical look at the physiology and management of mastitis. Mastitis, Camilla, it's a big topic, and a lot has changed, right? And there's the new protocol and such. So, talk to us a little bit about it. What can we look forward to, and yeah, I think you also go in your presentation a little bit about you in the history of mastitis, our understanding, how treatment has evolved over years and such. So guide us through what we can look forward to and you hope
Mhm.
we will learn.
Mhm. Yes, first there will be a little very short overview about the history of mastitis, because if breastfeeding has been going on forever
Yes.
in the human race, well, mastitis must have been a part of it. And what how did we treat that before? When did the big push towards antibiotic treatment begin, and why?
Mhm.
I think that's something to keep in mind. And then I'll briefly go through the recent the do we know? I mean, we know what mastitis is. We've always known. It's one of the, I'd say, the very few things that are clear in medical textbooks. It's mastitis and its management. But now these last years, a lot of things have been cropping up. The new ABA protocol, which changed some of our ideas. Then terms like subacute mastitis, subclinical mastitis, chronic breast pain, all these different terms that some of us feel they don't really add anything except confusion to the
Mm.
mastitis panorama, and that's something that I want to put forward and that I would love to discuss with all our people who attend.
That's wonderful. So yeah, that's an interesting what you're explaining there. That you feel like there is not enough, that it brings more confusion than it adds to the understanding of mastitis. And I know you're also a researcher. You go really deep into the matter of things. You don't leave it alone until you really know. Go to the bottom of this. So I know you will be looking at this also with what does the research actually say, right? Can you talk a little bit about
Mhm.
that?
Yes, the problem we have with research is that it gives us um, it hasn't really cleared up much of anything, actually. We know maybe more about the anatomy and the physiology of the breast, but
Hmm.
nothing's really cleared up on the mastitis end. I mean, scientifically wise. And
Hmm.
then there's all these studies coming up, for example, about probiotics, which, as I will show you, they're not really very good studies and they don't
Hmm.
really support the use of probiotics. And then we have new terms like dysbiosis, which is also not a very useful term. Actually, it's when I present this topic, I'm always debating between is it really complicated or is it really simple?
Hmm. That's interesting.
And
Yeah.
and 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 I think actually the most important part of my talk will be the debate we can have afterwards in the chat because I would
Yeah.
love to hear what people have to say about
Uh,
this.
Absolutely right. And we will have a live Q&A after your presentation. So everyone
Hmm.
who's watching the presentation can ask questions and contribute to the discussion, and we'll pick those questions up afterwards in the Q&A. So that is also a way to really get into this, to see also, you mentioned confusion there. And my question now is, if you, as a healthcare practitioner and doctor, an IBCLC who's been working in the field for decades, find it confusing. I'm just wondering, there must be a lot of other healthcare providers out there who also struggle or deal with this and thinking, what do I do now with this? How do I educate my patients? How can I, implement this? So talk to me a little bit about that. What have you heard? Have you heard anything in your field from other colleagues?
Yes, I've heard that the confusion sometimes stems from um, calling mastitis, giving the name mastitis to things that are not an inflammation or an infection of the breast, like
Hmm.
a woman with chronic pain or with shooting pains. That's not a mastitis; those are shooting pains, and we
Hmm.
have to figure out why she's having shooting pains. But if we
Right.
tag it like mastitis, it all gets confused because then how do I manage this?
Mhm.
And I think that's where I feel, or for example, I've come to, in the hospital, you see people talking and they're talking about subacute mastitis and subclinical mastitis, and they're using the different terms for same kind of symptoms. Everybody's kind of confused, which is which and what do I do about it. And then there's also a lot of confusion going on about should milk be cultured and what do the results mean, and what if I find Staph aureus or Staph epidermidis? What does all this mean, and what do I do about it? And
Mhm.
actually, I find that despite all this new information coming out, the way that I'm managing the classical acute lactational mastitis is exactly the same.
Interesting. Interesting. Yeah. And I think also, I mean, and correct me if I'm wrong there, because you're also working with parents, if healthcare providers find this confusing what about the parents? I mean, like they're bombarded with all this information now, these new terms, this how it must be it could be overwhelming for them.
Hmm. Hmm. Yes, and a major problem I see at our clinic is that sometimes mothers and parents will come in self-diagnosed because they've
Hmm.
looked up for things online, and then,
Right.
like a mother will come and say, "Oh, I have subacute mastitis, and I've already been taking antibiotic," and
Hmm.
it's like
Interesting.
that's not good. That's not good.
Yeah, absolutely. And you brought up a very important point there because parents and they want to educate themselves. They read stuff, they look for
Hmm.
things on the internet or maybe support groups or whatever is out there. Of course, it's
Hmm.
good to have that community, but it's also a dangerous space, as I like to say, because not all the information is helpful and correct. And then self-diagnosing, that brings up another
Hmm.
layer on top of the original problem at all, right? Like
Hmm.
having to
Exactly.
deal with that. Yeah, yeah,
Exactly.
very true.
And sometimes the problem is since healthcare professionals hardly know anything about breastfeeding, when a patient comes to them and says, "I believe I have this," for example, the
Hmm.
subacute mastitis, the sometimes their family physician will say, "Oh, okay, good, then just take this antibiotic," without really knowing anything about that and and not doing the research. So,
Hmm.
it gets confusing. And for me, the sad part is that person is going to get an antibiotic that there's no need, and that's
Hmm.
going to mess up the flora
Right.
again and just create
Absolutely.
more problems.
Create more problems. Absolutely. So before I let you go here today, what are your last words here for our audience? What you're hoping they will take from this presentation and, just what you hope to achieve here?
Well, I hope they will take some confidence in themselves, in their skill to treat or to manage or support a person with mastitis, because I don't think it's difficult.
Hmm.
And also, I would like them to be very critical of articles that are published, especially those that are published by people who are going to make money out of the results of
Mm-hmm.
those studies.
Hmm.
We have to be smart.
We have to be smart. Well, thank you so very much for sitting down here with us at this time and talk about your presentation and all the amazing work you're doing out there in the community. It was such a pleasure having you here today.
Thank you so much. Pleasure for me too.
And this presentation titled Breast-Related Pathologies of the Learning Day is titled Breast-Related Pathologies and Clinical Management During Lactation. We have 3 presentations on that day. So this presentation, The Art and Science, a critical look at the physiology and management of mastitis, is one of them. This will be live on August 19th. I hope everybody can join us. But of course, everything will also be recorded. So please go to goldlearning.com to find out more information. And I hope to see everyone at the Gold Learning Day. Thank you for being here today. And thank you. And I hope to see you then. Bye-bye, everyone.